Cape May, New Jersey at Christmas. This is where Andy and Emily Gotwols like to spend the holidays.
When we first met, we wanted to do something that was unique to us, and we discovered that we both enjoy going to Cape May, and we discovered the Queen Victoria, the B&B down there, and we really like it.
It's just a unique setting. We love the simplicity of it. It kind of reminds you of a Dickens Christmas, and because of that, we tried to make it an annual tradition that we would go every year.
A season of giving. Andy remembers how an act of kindness changed his life.
Emily's parents actually gifted me a Lifeline scan, and I begrudgingly went.
While there, a nurse asked a question Andy will never forget. Do you want a PSA test?
It was a split-second decision because I'm a young guy and I'm healthy, and I had no problems, no symptoms, no signs that I had anything wrong with me. So it was a conscious split-second decision that I agreed to have this blood test done.
That split-second decision positively changed Andy's life. He received the results 2 weeks later.
And I was reading everything, and bold red, my PSA was 31. And I knew that it was not right. That's egregiously high. And I looked right at Emily and I said, that's cancer.
When we got the results, it was scary, but I tried to have faith that it was going to be something other than what seemed like the obvious, which was a cancer diagnosis.
Andy didn't waste any time. He reached out to his family doctor.
I was immediately sent for more labs to confirm that number, and x-rays, obviously. And that lab work came back and my PSA was 33. And so the journey started.
His journey took him to Penn State Health for more testing.
I had an MRI and that showed a very large tumor on the left side of my prostate. From there, I was fast-tracked to a biopsy.
The results of the biopsy confirmed his worst fear.
He told me that I had cancer, and I had prostate cancer, and that I had a very aggressive prostate cancer.
We were both devastated to find out that the diagnosis was going to be cancer, and it was a struggle. It was an emotional response for both of us.
When you're a young person, and I don't care who you are, and you have a diagnosis of cancer, you're scared. You're scared. You are scared.
So Andy and I talked about different treatment options for high-risk prostate cancer. And in his case, the options are surgery or radiation with hormonal therapy.
2 months after being diagnosed, Andy had surgery.
I performed a radical prostatectomy and pelvic lymph node dissection for Andy. I removed his prostate and seminal vesicle, and I removed the lymph node from both sides of his pelvic side wall, close to where the prostate is. I removed a total of 17 lymph nodes, and 7 out of those lymph nodes came back positive for prostate cancer.
After surgery, doctors rechecked Andy's PSA level. His numbers were still elevated.
His repeat PSMA scan showed that he still has some positive lymph node in the pelvic area. And at this point, I refer him to my colleague in radiation oncology, and I also discussed with Andy about starting hormonal therapy.
Andy went through 8 weeks of radiation and has continued hormonal therapy.
Emily was there with me as we rang that bell. It took a weight off your shoulders.
He's doing really well. Now that the radiation is over, I think he's on the upswing. He's getting back to himself. He's finally starting to feel like himself and having more energy.
As an athlete, Andy views cancer as a marathon, not a sprint.
If you've ever ran a marathon, you know what I'm talking about. If you're an endurance athlete, you know what I'm talking about. It's not about the sprint. It's about the long haul.
Andy received some great news. He is in remission and his PSA level is undetectable.
through God's grace, here I am. I'm a living example of successful prostate cancer treatment, especially through Penn State.
Andy told me again this afternoon he hopes by sharing his journey, he will help someone else. This Christmas, Andy and Emily plan to spend the holidays at Cape May. And joining us is Dr. Truong, urologic oncologist at Penn State Health, and also Andy's surgeon. Andy has an amazing story, an amazing spirit. How's he doing?
Yeah, Andy is a very resilient and strong person. He was engaged and proactive in his care. His last PSA level is undetectable. That means that there is no sign of cancer, and he's still in good spirit. Andy and I celebrate every success, every undetectable PSA level, completion of radiation, but we remain vigilant. We're going to monitor his cancer very closely.
Yeah, that is wonderful. How does everyone work together and work so well to make sure that each patient gets the best treatment?
At Penn State Health, we take a collaborative approach to cancer care to make sure that patients have the best chance at beating the cancer and going back to their normal life. Every week we have a tumor board where I meet with experts from different specialties like pathology, radiation oncology, medical oncology, radiology, to review patient information, and together we come up with a comprehensive treatment plan for our patients.
Everyone working together, all under one roof.
Absolutely.
Now, Andy really credits you and his in-laws for saving his life, and as I mentioned, he really hopes he can save someone's life by telling this story. Why is community education about prostate cancer so important?
Yeah, community education empowers people with the knowledge and awareness that can ultimately save life. It's like switching the light on in a dark room. You take away the uncertainty. And if people know what prostate cancer is, how it is screened, how it is treated, they can make informed decisions about getting screened, about seeking medical attention when it's still early and treatable. And when they present it with the options, they can choose the treatment approach that is most aligned with their value and preferences.
Okay, thank you so much, Dr.
You're
Truong.
welcome. Thank you.